Hello everyone, and let us start with this crash course in microbiology. My name is Dr. Iftikhar Ali, and I'm a microbiologist and a doctor. And today, as we have said just now, we are going to start on the microbiology crash course, which will be a short but comprehensive course on microbiology. And to start with, we have to first go to what are the major groups of microorganisms that are to be discussed in microbiology. So the 5 groups of organisms that are discussed under the heading of microbiology are the bacteria, the viruses, the fungi, the parasites, and lastly, and these are the newest entrants to the microbiology world, those are the prions. Okay, so what are bacteria? Bacteria are prokaryotic, single-celled organisms. What do you understand by prokaryotic? If you really look at the cell structures, there are 2 main types of cell structures. One are the eukaryotic and the prokaryotic. So the eukaryotic cells are the cells that we generally learn since our childhood in biology, where the cell has all the structures like nucleus, mitochondria, endoplasmic reticulum, Golgi apparatus, all those regular structures. Whereas a prokaryotic cell doesn't have all these regular structure like the nucleus. It lacks a nucleus, it lacks a mitochondrium, it lacks the Golgi apparatus, and it lacks the endoplasmic reticulum. Apart from this, most of the non-capsulated structures are present in a prokaryotic cell. So this is the basic difference between a prokaryotic and a eukaryotic cell. The eukaryotic cells have all the regular cell organelles that we learn about, and prokaryotic cells have only a few of them. Okay, so bacteria are prokaryotic and they are single-celled organisms. Viruses, they are acellular, they don't have a cellular structure, and they always require host cells to replicate. So they cannot replicate by themselves, they have to have a host cell to replicate. Then fungi are the eukaryotic organisms. Their cells are similar to human and animal cells, and they contain all the regular organelles like mitochondria, nucleus, endoplasmic reticulum, all of those, and that is why they are called the eukaryotic organisms, and included among them are the yeasts and the molds. And then we have the parasites. Parasites are, the name itself indicates, they live on or in the host organisms. They do not exist independently. They have to have a host organism to survive, and they are also eukaryotic. And finally, prions. Prions are the latest entrants, as I said, to the microbiology world. They are not actually organisms. They are basically infectious proteins, and they are mostly responsible for some neurodegenerative diseases, which are like slow degeneration of the nervous system, and we will come to these examples when we come to the prions. So what we need to remember about them are they are infectious proteins and they cause neurodegenerative diseases. Okay, so coming to the next thing, what do the external surface of the bacteria and the internal surface of the bacteria look like? So the external surface of the bacteria, they contain mainly firstly the outer capsule. Over that capsule we have these 2 very important organelles. One is the flagellum, the other one is the pilus. So remember that pilus is the organ of adhesion, and flagellum are the organs of locomotion. Okay, so you can remember flagellum as moving forward. So forward and flagellum, both of them start with F. So flagellum is a organelle that helps in movement of the organism, whereas pilus is an organism which helps in adherence to the surfaces of the mucosa, or wherever the bacteria is adhering to, the pilus helps in adherence. Okay, and then this is how the bacteria looks on the inside. So it has a capsule, it has a cell wall, and then it has a plasma membrane. They are mostly three-layered, and then inside we have the instead of the nucleus, we said it does not have a nucleus. So instead of a nucleus, it has a nucleoid. Then it has ribosomes, but they are not attached to the endoplasmic reticulum, and they also have the organelles called plasmids. So these are generally the structures. This is the outer structure, this is the inner structure of the bacteria. Coming next to the metabolic pathways, how do the bacteria survive? How are they able to live in the environments that they choose to live in? So this is about that. And how do they respire? How do they breathe? So number one is the aerobic respiration, second is the anaerobic respiration, and third is the fermentation. So these are the three methods by which bacteria survive and live. So the aerobic respiration, that means that the bacteria cannot survive without oxygen. They have to have oxygen to survive, and that is why they are called the obligate aerobes. Okay, so what does it do with these oxygens? The oxygen is used to generate adenosine triphosphate or ATP, and this is how the bacteria are able to survive. Example of these aerobic organisms are the Mycobacterium tuberculosis and Pseudomonas aeruginosa. Mycobacterium tuberculosis causes TB, the very famous disease, and Pseudomonas, they are mostly responsible for wound infections. Okay, so these are examples of aerobic respiration where the organism absolutely requires oxygen to survive. Whereas the second one is the anaerobic respiration, and in anaerobic respiration, the organism does not require oxygen, and in some cases it actually dies in the presence of oxygen. So that is called anaerobic respiration, and the obligate anaerobes are the ones which cannot survive in the presence of oxygen. They can die in the presence of oxygen, and they use molecules instead of oxygen, other than oxygen, to generate the ATP. And the third method of generating ATP is the fermentation, where they can use the oxygen and they can also exist without oxygen. And the examples of these are the Lactobacillus acidophilus. They are mostly used as probiotics, probiotic supplements. Whenever we may be able to find them in most of the department stores where they use these probiotics. And these probiotics are mainly composed of this Lactobacillus, which is a human gut probiotic, which causes the addition of the essential organisms to the human gut, and they generate ATP without using the electron transport chain for it. So they are mostly facultative, which means that they can survive in oxygen and also without oxygen. So this is the specialty of these organisms. So these are the three metabolic pathways for respiration of bacteria. One is the aerobic respiration, second is the anaerobic respiration, and third one is the fermentation. So moving forward, these four organisms that we just learned about, the bacteria, which are the single celled, and the prokaryotes, viruses, which are the acellular and they require hosts, fungi, which are the eukaryotic organisms, and protozoa, which are the single celled parasites. Okay, so let us just go ahead and tackle a question which you may be expecting in one of your competitive exams. So the question goes like this: a 45-year-old man presents to the emergency department with a high fever, chills, and productive cough. Sputum culture grows a gram-negative rod that is oxidase positive and shows a rapid fermentation of glucose. Now, further testing reveals that the bacterium can utilize oxygen for respiration, but can also survive in low oxygen environments by fermenting carbohydrates. Which of the following statements best describes the respiratory strategy employed by this organism? Now, this is a classical question where the question is long, but the actual part of the question comes at the end. So most of the questions in the competitive exams are like this. The most important part is always the last part of the question. So it may be a good practice for us to first read the last line of the question and then go into the main matter of the question, the material of the question, so that it becomes more easier for us to understand and also easier for us to answer, and also may save a lot of time for us, because most of these exams, they are timed exams, and usually you don't have a little bit, you have a little bit more than 1 minute to answer each question. So the time is of utmost importance here, and this is a good way of saving your time. So first read the last line. So what does the last line say here? Which of the following statements best describes the respiratory strategy employed by this organism? So the question is asking you about the respiratory strategy. And a lot of the question is also based on what we just learned about the respiration of the bacteria, where here we have a bacteria basically which is able to survive in oxygen by utilizing oxygen, and also it can survive in low oxygen where the oxygen may not be present. So this is basically a facultative organism, right? So now coming to our choices. So A, it is strictly aerobic and requires oxygen for all metabolic processes. This is probably not right, because it already says that it can survive in both oxygen and without oxygen. It's strictly anaerobic, which means that it cannot survive in oxygen, which is also not true here. And then third is it is facultatively anaerobic and can switch between aerobic and fermentation. This is probably right, because this is what the question also talks about, that it can survive in both these environments. And last two are the microaerophilic and an obligate fermenter, which are both of them are probably wrong. So we have the correct answer as C. So it is facultatively anaerobic and can switch between aerobic and fermentation. So this is our answer here. So the organism in the vignette is described as being able to utilize oxygen but can also survive in low oxygen environments. This indicates that it is facultatively anaerobic, meaning it can grow in presence of oxygen as well as absence of oxygen. So remember that facultative always means that it can survive in both these or both the environments of oxygen as well as without oxygen. Whereas obligate means it can either survive only in oxygen or it can only survive without oxygen. Okay, so this is how we are going to employ the technique for answering these questions. So as I said, first always read the last line, then go into the question, and then you will know what the question is talking about and what it is asking, and then quickly go through the choices. Try to first rule out the bad ones, the wrong ones, and then zero in on the correct answer. Okay, so as we move, we will be tackling some more questions, but let us move forward for now. Coming to the bacterial shapes, we have four principal shapes of the bacteria. So number one are the round shaped bacteria or oval shaped bacteria. Second one are the rod shaped bacteria. Third one are the comma shaped bacteria. And the fourth one are the spiral bacteria. Okay, so those are the four different shapes of bacteria that exist. Now, if we come to these round or oval shaped bacteria, they may sometimes exist as clusters or they may exist as chains, like chains of pearls, like we see here. Okay, so the chains that exist, the bacteria that exist in chains, they are the streptococci, whereas the ones who exist in clusters are the staphylococci. And then the bacteria that exist as rods, examples of those are the very famous ones that cause diarrhea, Escherichia E. coli or Escherichia coli. They also cause the urinary tract infections. And then the third one are the comma-shaped bacteria, which are the vibrios. Example of this organism are the Vibrio cholera, causing that very famous disease called cholera. And the last one are the spiral-shaped bacteria. Examples of these bacteria are the spirochetes, causing the famous sexually transmitted disease called syphilis, and the organism causing that is called Treponema pallidum. So the Treponema pallidum is the spiral-shaped spirochete. Cholera is the Vibrio cholera is the comma-shaped. The Streptococci are the oval round-shaped bacteria present in chains, and examples of the rod-shaped bacteria are the E. coli and Pseudomonas. So just to use some mnemonics for you, always try to remember that strip the chain. So we have the strip the chain. The strep, as we said, they are the organisms that exist in chains, round oval bacteria existing in chains. So remember, strip the chain. So whenever you see a bacteria, oval bacteria, round bacteria present in chains, the first organism that should come to your mind should be the Streptococci. Okay, whereas when they are existing in clusters, the fruit that comes to your mind is grapes. And when you think about grape clusters, you should be thinking about Staphylococci. So these are the two very important and main types of cocci, the Streptococci and the Staphylococci, which may be coming repeatedly for you in various spheres of your journey through medicine. And that is why we should remember that the clusters are the staph and the chains are the strep. Okay, so now going to our next slide, which talks about the classification of bacteria. Now, the classification of bacteria is mainly based on a staining technique, which is called the gram staining. Okay, so based on this gram staining technique, we have divided the bacteria into two types, which are the gram positive and the gram negative. Okay, so now a little bit of history for you. This gram staining technique was developed by a scientist called Hans Christian Gram, and this was back in the 1800s, late 1800s. So he has done such a great job of classifying bacteria that even to this day, this is the same technique that is used to classify bacteria. So we have the gram positive and the gram negative. So what are the gram positive and why are they called gram positive? So they are called gram positive because they are thick, they have a thick peptidoglycan layer, and this layer causes retention of the primary stain. So there are basically two stains that are used for this staining technique. One is the primary stain, which is purple, and the secondary stain, which is pink. Okay, so let me repeat that. The two main stains that are used for gram staining are the primary stain, which is purple, and a secondary stain, which is pink. Okay, so the gram positive bacteria, because of their thick peptidoglycan layer, they are able to retain the crystal violet, the purple stain or the primary stain, and they appear purple in color. Whereas the gram negative bacteria, they lose the primary stain, they are not able to retain the primary stain, and that is why they finally retain the secondary stain and they appear as pink. I hope this is clear. So the gram positive bacteria, because of the thicker layer, outside layer, which is the peptidoglycan layer, they are appearing purple because they are retaining the purple stain, and the gram negative are appearing pink because they are losing the primary stain and they are able to retain the secondary stain. So this is the gram positive and the gram negative bacteria. And examples of gram positive are, as we just discussed, they are the Staphylococcus and the Streptococcus are examples of the gram positive bacteria, and you will call them gram positive cocci because of their round shape, and they are retaining the crystal violet and they have a thick cell wall. And then the gram negative bacteria, example of those are the E. coli or the Escherichia coli. They do not retain the primary stain because they have a thin cell wall. Okay, so hope that is understood well and truly, because this is very, very important for you to understand to go forward in the classification of bacteria. Okay, so again, another mnemonic for you to remember this more clearly. So generally, we find long PPTs very boring, and that is one of the reasons why we have tried to keep this PPT rather short. So what does the long PPT stand for? L is the lipopolysaccharide, O is the outer membrane, N is negative, and G is gram. So gram-negative organisms have an outer membrane which contains lipopolysaccharide. Okay, so gram-negative bacteria contain outer membrane which contains lipopolysaccharide, whereas the gram-positive bacteria, they contain peptidoglycan, a thick peptidoglycan layer in their outer membrane along with teichoic acid. So that is the LONG and PPT. So LONG is the lipopolysaccharide, outer membrane negative and gram negative. And then the gram positive bacteria are the ones with a thick peptidoglycan layer and presence of teichoic acid. So this is how we basically differentiate between the gram positive and the gram negative bacteria. There are other ways also, but for the purpose of this course, I think this is quite sufficient for you to know. Coming to our second question. Here again, as we just discussed, let us first read the final line of the question, which says that which of the following characteristics is most likely associated with the bacterial pathogen responsible for her symptoms? So we are here talking about the characteristics of the pathogen which is causing the symptoms. So let us go to the question and read what the question is actually talking about. So here we have a 30-year-old woman, so it's basically a very young woman, presents to the clinic with a 2-day history of fever, sore throat, and difficulty swallowing. So what are we talking about here? We are basically talking about a upper respiratory infection, fever, sore throat, and difficulty swallowing. Then upon examination, her throat is erythematous. What do you understand by erythematous? Erythematous means it appears red with white exudates on the tonsils. So there are some white spots present on the tonsils also. So the throat is red and the tonsils have white spots on them. A rapid antigen test for group A Streptococcus is positive. So it's also telling you about the organism also. So the organism here is a group A Streptococcus. So what we are talking about here is basically strep throat. Okay, so this young woman has strep throat. So now the question becomes a little bit more easier and more clear, which says that which of the following characteristics is most likely associated with this organism, which is group A Streptococcus. Okay, so it has a thick peptidoglycan layer and lacks an outer membrane, or it possesses a lipopolysaccharides in its cell wall, or so we have these other choices. So now firstly, if we see the first choice, there itself it is showing the characteristics of a gram positive bacterium. Okay, so as we know, a group A Streptococcus is a gram positive coccus, and so we have to basically look for the characteristics of a gram positive coccus or gram positive organism. So here we have the choice which says it has a thick peptidoglycan layer and it lacks an outer membrane. So this is basically talking about a gram positive organism, and this is probably the right one. Then the others are basically talking about gram negative or some other kinds of organisms. So B is possesses lipopolysaccharides. We already read that where we said that about the long PPT. In that we said that the gram negative organisms contain lipopolysaccharide in their cell wall. So this is we are talking about the gram negative. Then it produces exotoxins that can cause severe complications such as toxic shock syndrome. So exotoxins, toxic shock syndrome, this is basically a characteristics of Staphylococcus. So we cannot put Streptococcus in this category. The next is typically resistant to penicillin due to the presence of beta-lactamases. So here we are talking about a penicillin-resistant organism, which again is not the case here because this is a more milder infection, a very short duration infection, and there is no indication of any antibiotic resistance in the question. So we cannot say that it is resistant to penicillin here. And then lastly, it is commonly associated with diarrhea due to its ability to produce endotoxins. So there is no mention of diarrhea here, so we basically rule out that organism also. So this is basically a Streptococcus, and this is a gram-positive organism. This is the characteristics of that organism. Okay, so going to the next one, the other tests that are done to confirm the different types of organisms. Okay, so the next test that we check for are the presence of endotoxins and the exotoxins. Okay, so endotoxins, remember there is an N in endotoxins, and the endotoxin are characteristic of gram-negative organisms, whereas the exotoxins are more characteristics of the gram-positive organisms. Okay, so going over our overall classification of bacteria, we have a gram-positive and the gram-negative bacteria. And the gram-positive, we have cocci bacilli. Gram-negative also, we have cocci and bacilli. Then in the gram-positive cocci, we have Staphylococcus and Streptococcus as our examples. In gram-positive bacilli, we have examples as Bacillus and Clostridium. In the gram-negative organisms, we again have cocci and bacilli, and we said that in the gram-negative cocci, the example are the Neisseria and the Pseudomonas. And among the gram-negative bacilli, we have a long list, among which is the most important, most common is the Escherichia coli. And second one is the Salmonella, which causes typhoid. Okay, so next question. A 45-year-old man with a history of chronic obstructive pulmonary disease, which is called the COPD, presents to the emergency department with a productive cough, fever, and shortness of breath. A sputum culture is obtained and the laboratory report that the organism is a gram-negative oxidase positive Coccobacillus. Okay, so first let us read what the last line of the question is. Which of the following bacterial genera is most likely responsible? So this is a straightforward, simple question. They are just asking you the genera of the bacterium that is responsible for this condition. So what is this condition now? Here, the man has a history of COPD and presents to the department with a productive cough, fever, and shortness of breath. What does this indicate? This indicates a lower respiratory infection or lower respiratory tract infection, also known as LRTI. Okay, so this is a lower respiratory tract infection, and the sputum culture is already showing a gram-negative oxidase positive Coccobacillus. It's showing a gram-negative organism. So if it is showing a gram-negative organism, then we already have it as a gram-negative organism. Going through our choices, we can straight away rule out the first two, which are gram-positive organisms, Streptococcus and Staphylococcus, and which brings to our third one, which is a gram-negative organism. But this is Neisseria, as we said, is mostly associated with sexually transmitted diseases. Here there is no indication of sexually transmitted disease, so it is not Neisseria. And then Clostridium is mainly associated with tetanus. So the last one remaining for us is the Haemophilus. So this is how we did this question, by ruling out the most unlikely choices, which were these 5, and then the last one remaining was Haemophilus. So Haemophilus influenza is the organism that we are talking about here. It causes the lower respiratory tract infection, and it is an oxidase positive organism, and especially it causes infections in individuals with pre-existing chronic obstructive pulmonary disease. Okay, so going to our next slide, the tests that are done to differentiate between different types of gram-positive organisms. So we already said that the most important and the most common organisms in the gram-positive list are the staph and the strep, the Staphylococcus and the Streptococci. And to differentiate between these two organisms, let us look at what the tests are done to differentiate between these two organisms. So let us first talk about this one. So these are the two organisms, gram-positive cocci in the staph and the strep, and the test that is done to differentiate between them is the Catalase test. Okay, so Catalase test is done to differentiate between Staphylococci and Streptococci. If it is a Catalase positive, then the organism is probably a Staphylococcus. And if it is catalase negative, it's a Streptococcus. Okay, so catalase positive staph, catalase negative staph. Simple? Okay. So next we can come to our previous slide, which talked about another test, which is the coagulase. So after doing the catalase test, we find the catalase test as positive. So as we just said, it is a Staphylococcus. So then we do a coagulase test. When we do the coagulase test and that also comes positive, then we put this organism as a Staphylococcus aureus. Okay, so Staphylococcus aureus, it is a coagulase positive organism. Okay, so here again we have a more better explanation of that. This the catalase test. If it's negative, it is strep, and if it is positive, it is staph. Okay, so another question for us here. First, read the last line of the question. Which of the following organisms is most likely responsible for this patient's infections? Okay, so we are again talking about simple, what is the organism they want to know. So the question here is 32-year-old woman presents to her primary care physician with recurrent skin infections. She reports having had several abscesses and furuncles over the past few months. A sample from one of the abscesses is sent for culture, and the laboratory performs a series of tests, including a catalase test. The results show that the organism produces catalase. Okay, so what is the organism? So here, what does this indicate? The most important point here that is mentioned is the catalase positive. Right, so the organism is producing catalase. That means it is a catalase positive organism. When it is a catalase positive organism, straight away our diagnosis is of Staphylococcus. And then there are the other features which are also indicating towards the Staphylococcus, which are the recurrent skin infections and then associated with fever and abscesses and furuncles, and all of these are indicative of a staph infection. So when we look at the choices, our choice becomes very simple. We do not even have to rule out anything. We have to keep our eyes focused for where the staph is mentioned, and the staph is mentioned in choice B. So that is Staphylococcus aureus, and the rest are all wrong, and the answer I have already given you. And the explanation also is that the catalase positive means staph, and that should seal our diagnosis here. Okay. Then coming to the gram negative, we already said that the catalase negative are the Streptococci, and then we have some further tests to be done in the Streptococci to determine what type of Streptococci they are. So they are the most important ones are the alpha hemolytic and beta hemolytic. So this is the test that is done to determine what type of gram negative we have. So these tests, remember, they are done only for gram-negative bacteria. They are not done for gram-positive bacteria. So firstly, the catalase test determines that it is catalase negative, where we come to a conclusion that it is most common, probably Streptococci. And once we know that it is a Streptococci, then we go ahead with these two tests, which is the alpha hemolytic and the beta hemolytic. And in this, we find that if the organism is alpha hemolytic, then it is either Strep pneumoniae or it is Streptococcus mitis, and if it is beta hemolytic, then it is either Streptococcus pyogenes or it is Strep agalacti. Okay, so coming to our next slide here, which again talks about this whole process, and this is given to you in a very brief diagram, which is easy to understand. So as we said, we first do the gram test. Gram staining. The gram staining showed that it's a gram positive organism and it's a gram positive cocci. So we have the gram positive cocci. We know that it can either be mostly Streptococcus or Staphylococcus. So we take this gram positive cocci and do a catalase test. In the catalase test, if it is catalase positive, it is staph, and if it is catalase negative, it is strep. So once we know it is catalase negative and it is strep, we do a growth on sheep blood agar. So we put these organisms on sheep blood agar and watch for the growth, and when all the organisms have grown on the sheep blood agar, we take a look at them and look for the area of hemolysis around the organisms. If there is complete hemolysis, that is called beta hemolytic, and if there is partial hemolysis, it is called alpha hemolytic. Okay, so if it is beta hemolytic, then we go ahead with our last test, which is the growth in the presence of bacitracin discs. So we put some bacitracin discs on these plates which have already shown some beta hemolytic growth, and we look for the positive and negative on the bacitracin, and if it is bacitracin sensitive, it is Streptococcus pyogenes, and if it is bacitracin not sensitive, then it is the other kind of beta hemolytic streptococci. Okay, so this is the strep pyogenes is the most common and the most deadly of these streptococci, and that is why we do this test, the bacitracin. And then second is the alpha hemolytic. If the organism is alpha hemolytic, we subject them to a different test, which is the optochin test. We put the optochin discs on the culture plates, and then if they are optochin sensitive, our conclusion should be Streptococcus pneumoniae, causing the very important disease called pneumonia. And if they are not sensitive or resistant to the optochin disc, then we go for the other alpha hemolytic streptococci. Okay, so going over this diagram once again, we get the gram-positive cocci, we do a Catalase test. If it's negative strep, they are positive, they are staph. Then the strep, once we know that it's a strep, we first do a growth on sheep blood agar. If there is complete hemolysis, they are called beta hemolytic. If there is partial hemolysis, they are called alpha hemolytic. And then if we have beta hemolytic, we do the bacitracin test. And if we have the alpha hemolytic, we do the optochin test. If it is bacitracin positive, it is strep pneumoniae. If they are negative, then there are other organisms. And same in alpha hemolytic, if they are optochin positive, they are strep pneumoniae, and if they are optochin negative, then they are other organisms. Okay. So coming to, this is our diagram also indicating mostly the same thing. And next is the antibiotic sensitivity that we are talking about here. Okay, so now, as we said, we already discussed what is going to happen if it's a Catalase negative and the gram negative bacilli. We went into all the details of the alpha hemolytic and beta hemolytic. Now here we are talking about the Catalase positive. Okay, so Catalase positive, that is the Staphylococcus. And in the Staphylococcus, we did a coagulase test, we said, which showed that the organism is coagulase positive, which is Staph aureus. So Staphylococcus aureus can also exist as a MRSA or MSSA. Okay, so MRSA is a very deadly and very dangerous organism, where it means that, what is the MRSA mean? MRSA means that they are resistant to penicillins, which are the main drugs for treatment of gram-positive organisms. So if they are resistant to that, then they can only be sensitive to some of the higher antibiotics like clindamycin and doxycycline. So that's why they are called MRSA, and they are very dangerous, and they mostly exist in very highly contaminated environments like hospital ICUs and hospital emergency wards. And these MRSA, they are mostly treated with clindamycin or doxycycline. And MSSA is the penicillin sensitive organisms, and they can be treated with any of the penicillins, the amoxicillin, clavulanic acid, cephalexin, doxycycline, clindamycin, any of those. Okay, so actually, why are we calling this MRSA and MSSA? MRSA is, we talk about only one penicillin, which is the methicillin. So that is why we use the word M. So they are methicillin resistant Staphylococcus aureus, and these are the methicillin sensitive Staphylococcus aureus. So when we are talking about methicillin, we are basically talking about all the penicillins. They are resistant to all penicillins, as well as the cephalosporins. So both of these classes of drugs, they are resistant to, so that's why they are called MRSA. And when they are sensitive to these drugs, they are called MSSA. Okay, so going over this slide once again, we have the gram-positive cocci, and they are catalase positive. Then they are most probably Staphylococcus. Then we do a coagulase test, and that is also positive. So we know that's a Staphylococcus aureus. And then this Staphylococcus aureus, we subject this to the test with methicillin. And if they are methicillin resistant, they are called the MRSA. And if they are methicillin sensitive, they are called the MSSA. MRSA, since they cannot be treated with any penicillin, they are usually treated with either SMX-TMP, clindamycin, or doxycycline. And the methicillin sensitive are the milder organism. There is no problem. We can treat them with amoxicillin and any of the cephalosporins, as well as doxycycline and clindamycin. Okay, so that is as far as the MRSA and MSSA is concerned. Coming to our next slide, which is the site of infection. What are the different sites that bacteria can infect, and what kind of infections the bacteria can cause? Okay, so the bacteria can cause, firstly starting with the head, they can cause meningitis in the central nervous system. The organisms that cause meningitis are Strep pneumoniae, Neisseria meningitidis, Haemophilus influenza, Escherichia coli, and the group B Streptococcus and Listeria. These are mainly the organisms which are responsible for CNS infections, which is meningitis. Then there are organisms that cause upper respiratory infections. What are the upper respiratory infections? They can be, actually they should have been both upper and lower, because pneumonia is basically a lower respiratory infection. Then otitis media, sinusitis, and pharyngitis are the upper respiratory infections. So all these respiratory infections, the organisms responsible for these are the Strep pneumoniae, H. influenzae, Haemophilus influenzae, and Moraxella catarrhalis. These are the three important organisms responsible for upper respiratory. Then we also have infections of the heart, which is called endocarditis. And the most important organism responsible for endocarditis is Streptococcus viridans. You need to remember this very important organism which is responsible for endocarditis, which is the Strep viridans. Then we have the dental abscesses, which are most commonly caused by Staphylococcus aureus. So Staphylococcus aureus you can remember for all skin and mucosal infections. Where a gram-positive organism is concerned, you always have to think about Staphylococcus aureus. Then UTI, the urinary tract infections. Most common organism of that is E. coli. And in the intestines, if there is a diarrhea or any colitis, we always think of Clostridium difficile and P. colitis. Both of these are the intestinal pathogens. And skin and soft tissue infections, again, just as I just said, most commonly the Staph aureus are responsible for them. And also sometimes group A Streptococci, which is also called the GAS. And the lesions that are caused are the impetigo, cellulitis, and diabetic foot. And lastly, the sexually transmitted diseases, most commonly they are caused by the gonorrhea bacteria, the chlamydia, and syphilis, as we just said, was caused by the treponema, and lastly the trichomonas, which causes a vaginitis. So these are the organisms which are causing the sexually transmitted diseases. Okay. And lastly, we come to our last question. So let's just go over the drugs that are mostly used for treatment of these infections. So for the CNS infections, the first line of drugs are the mostly penicillin G, ceftriaxone, and cefotaxime, of course, provided that the organism is not resistant to the penicillins. Then for the dental abscesses, again, mostly because the organism is staph, we mostly use amoxicillin, which is a kind of penicillin. And for the urinary tract infections, we have nitrofurantoin and SMX-TMP. And for STDs, we usually again use either the penicillins or the cephalosporins. And for the respiratory tract infections, mostly the first line of choice is the amoxicillin. And for the endocarditis, also the first drug of choice is the amoxicillin. Again, this is all provided the organism is not penicillin resistant. Okay. And For the intestinal infections, most common and the first choice is mostly vancomycin. And for the skin and soft tissue infections, we either have a topical application of mupirocin or fusidic acid, or oral drugs which can again be cephalosporins. Okay, so lastly, let us come to our last question in this presentation. As we said, first we read the last line of the question, which says, which of the following is the most likely site of infection? So here they are not asking about the organism, they are asking about the site of infection. Where is the infection occurring? So now going to the question. A 45-year-old man with a history of diabetes presents to the emergency department with fever, chills and pain in his right foot. Okay. On examination, there is swelling, redness and tenderness around the first metatarsophalangeal joint. The patient reports a history of a recent small cut on his foot that he did not initially treat. Blood cultures are obtained and he started on empiric antibiotics. Which of the following is the most likely site of infection? So number one is the skin and soft tissue. Second is the bone, joint, bloodstream and lungs. Okay. So this is not a very straightforward question. It can cause a little difficulty in understanding and answering. So it is talking about, so if we have to go to the question again, we are talking about his pain in his right foot, and there is fever and chills, which is basically indicating that the patient has an infection, and there is pain in his right foot. But then on examination, there is swelling and redness and tenderness around the first metatarsophalangeal joint. Okay, so when we are talking about swelling of a joint, then our focus should be on joint infection here. Okay, and when we are talking about joint infection, we have to think of a condition called septic arthritis, because this is like an infectious arthritis that can occur in cases where there is no proper treatment of the primary wound. If a person gets a cut on the leg and he also has a diabetes, as this question says, then he is more prone to getting infected, and most commonly the infection reaches the joint and causes the severe pain and tenderness of the joint, and this is why this can be a septic arthritis. Okay, so which is the most common site of infection, most likely to be the site of infection? The answer should be the joint, because here it's clearly mentioning about the first metatarsophalangeal joint. Okay, so the other choices are wrong, because the answer clearly is the joint infection. And here let us just go for a minute over the explanation. This patient presents with the classic symptoms of septic arthritis with pain, swelling and tenderness, and that is why we are, and of course he has a history of diabetes, and that is why we are coming to the conclusion that the patient has probably a septic arthritis. Okay, so that is as far as the bacterial portion of our crash course in microbiology, and we will try to focus on other topics as we move forward. And this is your friend Dr. Iftikhar Ali signing off for now. Thank you.